Tufts University is partnering with the Broad Institute to administer routine and exposure/symptom-based testing for the COVID-19 virus. When someone tests positive, Broad will notify the local Board of Health, and Tufts Health Services will notify that person. This will also initiate the contact tracing process with Marathon Health. Marathon Health will record the date of symptom onset and gather a list of close contacts within the Tufts community starting 48 hours prior to the onset of symptoms or positive test. Marathon Health will then notify all close Tufts contacts. All the information provided to the contact tracer is confidential. Those identified through contact tracing as someone who had close contact with you will not be given your name. Absolute honesty and prompt cooperation with the contact tracer are essential. Tufts has a pandemic amnesty policy, which ensures that information shared with a contact tracer will not be used to initiate disciplinary action. Your medical information will be held in confidence in accordance with HIPAA regulations and best practices. Select information about test results and the spread of the virus in our population will be shared with the local Board of Health. In addition, information about rates of infection will be shared with the community on a publicly available dashboard on the COVID-19 website. The purpose of contact tracing is to identify and notify in a timely manner close contacts of people who test positive for COVID-19 and to educate those contacts on quarantine instructions, symptom monitoring, and steps to take if they become symptomatic. Current guidance for exposure includes being within 6 feet of a COVID-19 positive person for more than 15 minutes. Passing someone in a hallway or being in the same building with an infected individual does not constitute exposure. If the contact tracing process indicates that you have had close contact with someone who has tested positive for COVID-19, you will be directed to quarantine. During quarantine, you may only leave your room to use the bathroom facilities, seek medical care, pick up needed health supplies like prescription or medication, and complete other tasks essential for your health. Tufts is an environment where close contact with people is very likely if you leave your room, so it is important to stay separated from others. During quarantine, do not have any visitors in person. You are encouraged to stay connected to family, friends, and classmates, members of your residential cohort, and others through means that allow you to maintain physical distance, like Zoom, FaceTime, or phone. During quarantine, your meals will be delivered to you twice per day by dining services. For your initial meal, Tufts Dining will contact you. For subsequent meals, Tufts Dining has a mobile app called Transact that you will need to download and use for this purpose. Wear a mask at all times when you leave your room, including when you are using shared restroom facilities. This is particularly essential in self-quarantine. During quarantine, monitor yourself for symptoms of COVID-19 and contact health services if you develop symptoms. Do not walk into health services or a routine testing location without an appointment. All visits to health services are by appointment only this fall. Your faculty members will be notified that you will not be coming to class in person, and you will be expected to participate in your coursework remotely. If you experience challenges with your coursework due to being in quarantine, contact your advising dean. If the contact tracing process indicates that you have had close contact with someone who has tested positive for COVID-19, you will be asked to quarantine. If you are asked to quarantine and you live off campus, stay in your apartment and use a separate bedroom if possible. Do not have visitors. Use a separate bathroom if possible. If only a shared bathroom is available, it is okay to use that, but be extra careful with hand washing and in wiping down the toilet handle, sink faucets, doorknobs, and light switches with an approved cleanser. Wear a mask at all times when you are out of your room, including when you are using shared restroom facilities. Practice physical distancing with other roommates. Use the kitchen when others are not present, and wipe down any surfaces you may have touched before leaving the kitchen. The university will provide non-contact delivery from Tufts Dining during quarantine, regardless of whether you are on a Tufts meal plan. Most students who test positive for COVID-19 will temporarily move to the mods for isolation and health monitoring. For those students attending the School of the Museum of Fine Arts at Boston and living off campus in Boston, Brewster Ambulance Services will provide transport from Boston to the mods on the Medford/Somerville campus. Generally, students will have no more than 90 minutes to move into the isolation units. Shortly after you have spoken with a clinician about your positive test, a residential life staff member will contact you to provide additional information about your isolation housing assignment. You must limit your contact with others, go to your residence hall room, and collect any belongings you may need for the next couple of weeks: books, computer, clothes, and bed sheets, and bring them to the isolation space. Because you will have 90 minutes to make this move, you should be able to make more than one trip. You should be the only one moving your belongings. Moving assistance is not advised because it will create additional close contacts. You may wish to have a bag prepared with toiletries and needed items to make it easier to add things in common use and go with ease. When you are in isolation, a health professional from health services or a special EMT service will check on you daily to provide monitoring for symptoms and appropriate healthcare services. Additionally, a staff member from the Office of Dean of Student Affairs will reach out with additional resources and support. After isolation is complete, students will be directly informed when they can return to their original housing space. When you are in isolation, a health professional from health services or a special EMT service will check on you daily to provide monitoring for symptoms and appropriate healthcare services. Additionally, a staff member from the Office of Dean of Student Affairs will reach out with additional resources and support. After isolation is complete, students will be directly informed when they can return to their original housing space. Thank you for doing your part to keep everyone in the Tufts community safe and healthy this fall.